joining us in webinar number 230 since the Andean Health Organization, Hipólito Unanue, Orasconu, initiated the cycle of seminars in May 2020. It's been 4 years of continuous learning since we initiated this webinar cycle. Today, it is a pleasure to talk about alert for global health, the danger of synthetic drugs. In 1971, with the creation of the Hipólito Unanue government agreement, the government of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela joined to work together and have regional integration to make health a bridge for peace and to work towards well-being. In this way, the Orasconu has an important history of unity, and the constant work with the ministries of health of all 6 countries in the Andean community in favor of materializing the right to health. During this technological globalization era, the COVID-19 pandemic reasserted the relevance of the healthcare sector to have a life with well-being. That's why today it is a priority to keep and to maintain health at the core of all the policies and social awareness so that we can get together towards the common well-being and to forward a society and care of life. Health is the bridge for integration and for peace. And that's why, as part of the strategic plan for integration of health 2023-2030 of the Orasconu, we say to ensure the full validity of the right to health with social justice and environmental justice, it is key to work intensely in the strengthening of all the health systems and emphasizing the primary health care. Reflections like this, you can find them in the Andean Notisalud Bulletin monthly edition that we would like to invite you to read and which is available on the Orasconu website and also on the knowledge wall of the Andean integration. We would like to invite you to drop your name, your organization, and the country you're from in the chat box of the Facebook Live or YouTube Live. In this very same space, you can leave your questions or submit them through the email webinar.orasconu@gmail.com. In order to access the certificate of attendance, as it is usual, in either the Facebook Live or YouTube Live chat box, you will find a link where you will find a brief survey. You can leave your information. But please make sure your email address is correctly written to submit the certificate. This certificate will be sent in the upcoming days to your email. On this webinar, we're going to follow the usual the dynamics. We will start with an institutional greeting. We will then have the keynote speeches, and then we will have a dialogue based on the questions asked by the participants and attendees in the different platforms. We would like to invite you to write your questions and comments. To start this important day, I'm going to give the floor to Dr. María del Carmen Calle Dávila, Executive Secretary of Orasconu, who will give the warmest welcome and the institutional greeting. It seems that we're having some technical difficulties.
Pedimos que esperen unos minutos hasta que la doctora Calle pueda volver a conectarse. Gracias.
Buenos problemas de conexión, pero ya estamos aquí otra vez.
Okay, we were having some connectivity issues, but now we are back. So between 2011 and 2021, the number of people that use and abuse drugs increased from 240 million to 296 million.
Un aumento significativo,
It's a
23%.
23% increase.
Entre ellas,
Among them,
se ha incrementado el
also
consumo de
the
drogas
consumption
sintéticas,
of synthetic drugs
como
has
la
increased,
metanfetamina,
like methamphetamine,
el fentanilo
fentanyl,
y las numerosas
and
sustancias
other
de nuevo
substances that
desarrollo en el
are
mercado.
newly developed in the
La
market.
problemática del tráfico de drogas
The
sintéticas
problem
tiene
of
un
synthetic drug
crecimiento
trafficking has been
exponencial en nuestra región.
exponentially growing in our
Hasta
region.
mediados del
Up
2023,
until
el
mid-2023,
informe mundial
the
sobre
World
las drogas
Report on
2023
Drugs
de la
2023
Oficina de Naciones
of
Unidas
the
contra la Droga y el
United
Delito
Nations Office Against Drug and Crime
reportaba que en
reported
Sudamérica el
that in
mercado de
South America,
producción de
the
estos
production market of
psicoactivos
these psychoactive
se mantenía
substances
en pequeña escala
was still in a low
en
scale
comparación con el mercado de drogas de origen vegetal,
as compared to
cocaína,
the
heroína
natural
y
or
marihuana.
vegetable or plant-based
Sin
drugs, which
embargo,
are
el
cocaine,
análisis
heroin, and
conjunto
marijuana.
entre la
However,
organización
the
Inside
joint
Crime y
analysis
Bryce
by
Pardo,
the
oficial de
Insight Crime and
investigación de la
Bryce Pardo,
Oficina
which is a
de las
research
Naciones
official
Unidas contra la
of
Droga y
the
el
United
Delito,
Nations Office Against Crime and
pronosticó
Drug and Crime, they
que el
forecasted
mercado ya
that the
existente en
market
nuestra
that already
región
exists in our
allanaría
region
el flujo de
would
las drogas
definitely
sintéticas,
help the
cuyos
synthetic drugs
costos
grow,
tiempo de
whose
producción
costs and
son menores,
production times are
al no
lower
depender
because they do not
de una
depend on any
geografía y de los
geography
tiempos de
or
cosecha.
any harvesting times.
En 2024
In
se ve la
2024,
explosión de la
we can
demanda
see now
desde
that the
mediados
demand
del
has been
2017
skyrocketing
en
slowly
algunos
since
países
mid-2017 in some Latin
latinoamericanos,
American countries,
principalmente
mainly
México y
Mexico
Brasil.
and Brazil.
Nuestra política
Our
andina de salud
Andean
mental,
policy for
que
mental
fue en
health,
2020,
which was issued in
presenta en su
2020,
primera línea
is
estratégica
now
el
including within its
compromiso
first
de los
strategic line
países
the
andinos
commitment
en
of the
el
Andean
abordaje de
countries
las
to address
intervenciones
the
de
interventions
promoción de
to
salud
promote
mental y
mental health
prevención
and to
del
prevent the
consumo
consumption
de
of psychoactive
sustancias
substances,
psicoactivas, con especial
with a
énfasis en la
special emphasis in
incidencia
the
sobre los
on the
contextos de
incidence
vida,
of
las
the
condiciones
life
sociales y la
context, social
atención de los
conditions,
ciudadanos
and
que habitan en el
care
área andina.
provided to the citizens that
Esto
live in the
implica
Andean community.
acciones
And this implies
colaborativas
to have
con
collaborative
múltiples
actions
sectores para
that are multifaceted
proteger los derechos,
to protect the
reducir la
rights, to
exposición a
reduce
factores de
exposure
riesgo
to risk
y
factors,
fortalecer
and
las
to
habilidades
strengthen the emotional
emocionales de
skills
niñas, niños y
of boys,
adolescentes
girls, and
y jóvenes
adolescents,
en los
and of
diversos
youth
contextos
in
en los
the
que
different
transitan.
contexts where they live and
Brindar
spend their
atención
lives,
de salud mental
to
temprana,
provide early
especialmente en las
mental health
generaciones
intervention,
más jóvenes.
especially in the younger generations,
Impulsar la
to
investigación
foster
interdisciplinaria
research,
para
interdisciplinary
conocer las
research,
cadenas
in order
ilícitas
to
de
get to
producción
know
y distribución
the um,
nacionales e
illegal
internacionales
distribution
y
uh,
incidir para
chains,
mejorar los estándares de calidad en la producción y
to
distribución
have
farmacéutica,
advocacy also to
fortalecer las
improve the
estrategias de fiscalización
quality
de las
standards
farmacéuticas,
in the production and pharmaceutical distribution, and to
fortalecer las
strengthen the
figuras
strategies to
penales de
oversee the
producción y
pharmaceutical
tráfico de
industry,
drogas,
to strengthen the
desarrollar
sanctions for production and
estrategias
drug trafficking, and
eficientes
to develop
de
efficient
atención y
strategies to
acompañamiento a las
support and
personas
accompany the
con
persons who have
trastornos por
a
consumo de
disorder
sustancias,
that
a fin
makes them
de
consume
impulsar la
drugs in order to
rehabilitación
promote
y la
rehabilitation
inserción
and
social de los
social
mismos.
reinstatement and
Para
reinsertion
conocer
of these
más sobre
people.
la
In
situación
order to know
actual de la
more about the
problemática
current
del tráfico de
situation
drogas
of
sintéticas
synthetic
región
drug
y
trafficking
la
in our region
respuesta
and all of the international
internacional,
responses that
hoy
exist, we
contamos con
now
los
have
expertos
today we
Héctor
have the
Bernal de la
experts
Oficina de
Héctor
las
Bernal
Naciones Unidas
from the
contra
United
la
Nations
droga y
Office
el
Against
Delito
Drug
y
and Crime
Claudio
and
Vidal
Claudio
de
Vidal
la Red
from the
Iberoamericana de ONGs que
Ibero-American
trabajan
network
con
of
drogas y
nonprofits that
adicciones.
work on drugs and
Estimados
addictions.
expertos,
Dear
desde
experts,
ya les
we
agradecemos
already thank
sobremanera
you
por
for
compartir
sharing
sus
your
valiosos
valuable knowledge
conocimientos a través de
today
nuestro
in our
webinar
webinar number
número
230.
230. A la audiencia
To
síncrona y
all of
asíncrona,
our
les
audience
damos
and
la
the
más
attendees,
cordial
we would like
bienvenida
to give
y
you the warmest
esperamos
welcome,
que
and we
este
really hope
espacio
that
de
this learning forum
ciberaprendizaje
would
sea de gran
is very
provecho
productive and
para
useful
tomar
for you
acciones
to take
pertinentes
the relevant
desde nuestros
actions from
espacios de
our
influencia.
spaces of influence.
Bienvenidos, bienvenidos.
Welcome, and everybody.
Bien, gracias, doctora Carmen, por esas importantes palabras de
Thank
introducción
you, Dr.
a
Mari
nuestro
Carmen
webinar.
Calle, for
Y
these
a continuación
introductory words.
paso a
And next,
presentarme.
I am
Mi
going
nombre es
to introduce
Ruby
myself. My
Díaz
name is Ruby
Arotoma, soy
Diaz
profesional de
Arotoma.
salud
I
pública,
am a public
salud
health
global.
professional and global health
Soy miembro
professional.
también de la
I am
línea de
also a
garantía
member
de
of
la defensa de los
the
derechos de
uh,
niñas, adolescentes y jóvenes en el ORAS-CONU. Y hoy, con mucho
Orasconu
agrado,
team.
estaré a
And
cargo
today
de
I am
moderar
going
este
to
webinar.
be moderating this
A
webinar.
continuación, le damos la
Next,
más cordial
we would like to
bienvenida
give the
al
warmest welcome
magíster Héctor
to
Bernal,
Mr.
quien es
Héctor Bernal.
coordinador técnico del
He is a
programa
technical
regional STEM
coordinator of the
de
STAND regional
la
program of the
UNODC.
UNODC.
El magíster Bernal es profesional con 30 años
Mr.
de
Bernal
experiencia
is
en
a
el
professional with
diseño,
over 30 years of
implementación y
experience in
coordinación de
the design,
investigaciones,
implementation, and
estudios,
coordination
proyectos y
of
publicaciones en
research,
drogas
studies, projects, and
ilícitas de origen
publications
natural
on
y
illegal
sintético y sustancias
drugs,
químicas
both
empleadas para
natural
su
and
producción.
synthetic, and the chemical
Es
substances that are used in their
licenciado en
production.
química
He
y
has a
biología por la
degree in
Universidad de La
chemistry and
Salle,
biology by the La Salle
maestría en
University and a
fitotécnica
master's degree on
de la
phytotechnics
Universidad
by the
Federal de
Federal
Bahía de
University of
Brasil.
Bahia in Brazil.
Ha conformado y
He
liderado
has been
grupos y
part
comités
of
nacionales
groups and
e
led national
internacionales de
committees and
trabajo
international
e
committees and
investigación
task
en temas
forces on
relacionados con el
topics
control
related
e
with the
interdicción
control and
de
interdiction
drogas
of
ilícitas,
illegal drugs,
naturales y
both natural
sintéticas,
and synthetic,
sustancias
of
químicas
chemical
y
substances
aspectos
and
medioambientales
environmental aspects
asociados con los
associated
cultivos
to
lícitos
illegal
y
crops
actividades
and
forestas.
related activities.
Actualmente es
Currently,
coordinador técnico
he is a
regional del
technical, regional
programa
technical
STEM de
coordinator
la
of the
Oficina de las
stand-up
Naciones
program
Unidas
of the
contra la
United
Droga y
Nations
el
Office
Delito.
Against Drug and Crime.
Asimismo, trabaja en el
He
diseño
also
e
works in
implementación
the
de
design and
estrategias de
implementation
fortalecimiento
of
institucional
uh,
para llevar a
institutional
cabo
capacity
procesos
building
adecuados
strategies
de
so
disposición
that
final de
there
sustancias
are
químicas
adequate
y drogas
processes of the
incautadas
final
en
disposal of
Colombia,
chemical
Guatemala,
substances and
Perú,
drugs seized in
Ecuador,
Colombia,
Honduras
Guatemala,
y
Peru,
Paraguay.
Ecuador, Honduras, and Paraguay.
Adelante, estimado Magíster Bernal, el
Mr.
espacio
Bernal,
es suyo.
you have the floor.
Muchas gracias.
Thank you very
Ruby.
much,
Primero que todo,
Ruby.
un cordial
First of all, I
saludo
would like to
pues, a los organizadores
greet
de
you
esta
all and
conferencia
thank
de
the
tan importante,
organizers
especialmente ahora que
for
el tema
of
de drogas
these
ilícitas
important event because
digamos,
definitely
está manifestando unas dinámicas bastante
now,
interesantes
we see that
acá en
there's
nuestra
quite interesting
región.
dynamics in our region.
De parte de la Oficina de las Naciones
So on
Unidas
behalf of the
contra el
United
Delito y
Nations
contra la
Office
STAN,
Against Drug and Crime
agradecemos
and
por
the
la
STAND program, we would
invitación
like to thank you
a
for the
participar
invitation and to
en este
participate
proceso.
on this
Para
process.
comenzar, pues voy a compartir
Well,
mi
first I'm
presentación
going
por favor,
to
me
share my
confirman
screen.
que
Please let me know
el
if you
momento
can
en
see
que
this very well.
la estén viendo.
Listo, se ve muy bien.
Bueno,
Okay.
considerándole el
So,
espacio de tiempo que
considering
tenemos,
the
y
amount of time that I
especialmente pues,
have
el tema tan importante
and
que voy a
also
tratar de
the
ser lo más
important topic that we are
concreto
dealing with,
posible
I will try to be as concise as
y
possible.
adecuándome al tema lo más
And
sintético
then
posible
also,
para
I
poder
will also try to
explicar
be
una
very
problemática que
concrete
cada vez
in
crece más en la
explaining a
región.
problem that is
Si nosotros nos
increasingly growing in the
referimos
region. If
al,
we
al
talk about the World Report on Drugs, we can see that the problem at the level of our region, especially in Latin America, it continues being the natural drugs. That is, the most important problems are related with alkaloids that are extracted from the coca leaf, and then in some cases with those that are extracted from the poppy. But this doesn't mean that in the region do not see these new synthetic drugs. But as I said, the biggest problem regarding the consumption of drugs and trafficking of drugs
relacionado pues con lo que tiene que ver con las drogas
and
de
how
origen
we deal with the natural drugs. And as you can see in this heat map for our region, what is present and ever present and with a lot of with intensity is the paste, cocaine, carbohydrate, and then crack, which, while it is true in Latin America, it doesn't really exist, or there's no, crack in terms of the reversion of the base, but, it does happen in the region. There's other regions in the world where the synthetic drugs definitely is serious, especially in North America, and especially when it comes to fentanyl-related drugs, opioids, and also with those that are related to amphetamine and methamphetamine. And then also in Europe, where we see that all of these synthetic drugs have been increasing. So we are going to talk about our region. And like I said, worldwide, through the early warning system, in the UNODC, we have seen approximately 250 new psychoactive substances. The new psychoactive substances, the one that are not contained in the control lists. That is, the synthetic drugs, we also have psychoactive substances, and not necessarily all of them are synthetic, but they also generate a problem in terms of their consumption and especially in terms of trafficking. And then, why? In most of the countries that report these new psychoactive substances are countries that do not have the capacity to detect them. And this, happens in Latin America. We can see that where most of the countries do not have the capacity, the technological capacity from their forensic areas to actually be able to detect all of the drugs that may be traded and that may be consumed. And that's why if we see this map, in our region, we have between 50 to 100 new psychoactive substances, while, most of them have been reported in North America and Europe. And I said obviously because in Europe and in North America, they do have more technological capacity to be able to detect this kind of substances. And therefore, it doesn't mean that in Latin America only there are between 50 to 100 new drugs. There may be a lot more, but what we don't have yet is the capacity to be able to detect them adequately and to identify them and to be able to really pinpoint each one of them. So this has been, I think, one of the main difficulties that we have had in our region. So out of this big group, we can see that most of the synthetic drugs and all of these are related to methamphetamine or amphetamines, and this actually is the ones that are more represented here.
Del GHB, del ácido gamma hidroxibutírico, Y opioides especialmente
And
se han
then we have
encontrado y se ha
opioids
logrado
also. We
detectar
have
y
been able to
visualizar
detect
en
and in
Norteamérica, donde se
really
ha
pinpoint in
presentado y
North
se está
America
presentando la crisis
where
de
we can
opioides,
see the opioid
no se
crisis going
presenta
on. And this
afortunadamente
is
aún
fortunately not happening
en
yet
nuestra región.
in our region.
De las 1.235,
So out of the
más o menos, debe haber más de
1,235
sustancias psicoactivas
new
reportadas por el
psychoactive
sistema
substances that are
de
reported
nuestra
by
oficina,
the early
pues
system of our
la mayoría
office,
está
most of
corresponde a
them are,
fenetilamines, o sea, derivados
respond to
BPS, derivados de tipo
phenethylamines.
anfetamínico,
Yeah, okay.
cannabinoides sintéticos y nuevos
Synthetic
grupos que han
cannabinoids,
entrado como
and
los
then
grupos
new groups that
de
have
benzodiazepinas,
entered, like
¿cierto?
benzodiazepines.
De eso, pues,
So out of
285
these,
se han
285
registrado
are
en nuestro continente
have been
entero,
registered here in our
en nuestro
continent.
continente, digamos,
And
para hablar de Latinoamérica,
the just talking about
comparado
Latin America as such,
285 NPS,
285 new
seguramente hay muchos
psychoactive
más
substances.
en
Probably
el
there's a lot
mercado,
more.
¿sí? Y también siendo
And
preponderante el
then
grupo de
also
los
we
derivados
see that there is also those
de tipo
byproducts
anfetamínicos,
from the
¿cierto?
amphetamines.
Algunos cannabinoides
Some
sintéticos,
cannabinoids,
algunas
synthetic cannabinoids,
lisernamidas y
maybe
piperacina, ¿cierto?
some
En
lysergamides and
Brasil,
piperacins.
Colombia,
In
Paraguay,
Brazil,
Argentina,
Colombia,
Uruguay,
Paraguay,
se
Argentina,
ha
and
logrado
Uruguay,
detectar
we have been able to
opiáceos
detect
sintéticos. Se han
synthetic
detectado 10 tipos de
opioids,
opioides, se han
or
reportado, más
maybe
bien, se han
reported 10
reportado
types of
10
synthetic
opioides sintéticos relacionados o
opioids.
análogos del fentanilo, ¿cierto?
And
Considerando
this
que el
is,
fentanilo no es
related to
solo una
fentanyl,
molécula,
considering that
¿cierto? Sino que
fentanyl,
a toda esta cadena la llaman como
it's not just
fentanilo,
one. This whole family
independiente
is known as fentanyl,
de la
irrespective of
molécula del
their
precursor de que se
molecule,
vaya
of the molecule that
a
is contained
encontrar.
within.
En Sudamérica en total, como les
So
decía,
in South America, in total, like I said,
NPS
out of
se han
the
reportado. Aquí
uh,
están los grupos
273
digamos,
NPSs,
con
these
mayor
are the
frecuencia.
groups that have been reported more frequently.
Los sistemas de alerta temprana, que
And
son
the early warning
escasos en la
systems,
región,
which are very
y sus
scarce in the region,
capacidades
and
no
also,
son
the
comparables o
capacities are not
comparables a
comparable
los de
to
países
those
en Europa o
that can be
Norteamérica,
found in
pero lo que
Europe
más
or
se ha
in North
detectado
America.
han
But
sido
we have seen the most
precisamente
is
estimulantes de
precisely
tipo anfetamínico,
the
cannabinoides
amphetamine-related,
sintéticos y, como les decía,
and
algunos
also
opioides
synthetic
sintéticos,
cannabinoids
más o
and also
menos
some
10
synthetic opioids,
opioides
approximately 10
sintéticos.
different
Es
ones.
preocupante que
And
cada
so it's
vez
definitely
más
very
pues
concerning
están
that more and
detectando
more it looks
más
as if
de este tipo de
we are
sustancias, lo
detecting
que no
more
implica
of these kind of
necesariamente que aquí
substances.
haya
And
una
this doesn't
crisis
mean
como la de
necessarily that there is a
en
crisis like the
Norteamérica.
one we have in North
Mensajes claves
America.
para comprender
Now, what are the key
la
messages
situación de
to
nosotros
understand
aquí
our
en países de
situation here
Latinoamérica.
in the
Argentina
region?
y Chile
So
concentran más
Argentina
del
and
80% de
Chile
las
have more
incautaciones
than
de
80% of
drogas
the
sintéticas
seizures of all
en la región,
synthetic drugs in the
¿sí?
region.
Especialmente
So,
centrados
and especially
hacia
are mainly
éxtasis, ¿sí? Y ketamina,
ecstasy
pero no ketamina
and then
como
ketamine
una droga
also, but
independiente,
ketamine
sino
not as an
ketamina
independent drug,
haciendo
but
parte de
ketamine
mezclas de
as
drogas que se
part of,
comercializan
mixtures and combinations
en
of
la
drugs that
región.
are being sold in the region.
Una de las drogas, digamos,
One of
que más que
the
una droga
drugs that
individual
more
o
than an
específica,
individual or
ha
specific
tomado
drug
mucha
and
fuerza en
that
la región,
now
está
is going
relacionada
on
con la
strong in the
cocaína
country is related to
rosada, que
the
consideramos
pink
nosotros que
cocaine,
es más
which we believe is
digamos,
more a
marketing
term that implies
para
marketing.
una
It's more for
mezcla de
marketing,
drogas que no se
for
sabe
a
realmente
combination of drugs that we don't
específicamente
really
cuál
know
es, ¿sí?
specifically which
Es
one it
el
is.
marketing que se
So
ha
I think
dado
that's just
a un tipo de
marketing
droga
that
que ha
has been
tenido
given
mucho
to this kind
suceso,
of drug that
pero no es
has
una
had a
droga
lot of success, but I
específicamente que
don't
ha
think
ganado
that it is a
mucho
specific
espacio.
drug, and
No
it's
tenemos
been
nosotros,
used
digamos, evidencias
significantly, and
de
we don't really have
producción
any
de grandes
evidence of
volúmenes de drogas
production of big
desaparecidas en la
volumes of
región
uh,
de
this kind of
NPS.
synthetic drugs in the
Sabemos
region
de
or MPSs.
procesos
We
experimentales o
know about
procesos
some
que se han
experimental
iniciado en
processes
algunos
that
casos, como en
started
el caso
in
de
some
Brasil,
cases,
con la
like in the case of
MDMA,
Brazil
con
with
algunos
MDMA
cannabinoides
with
sintéticos,
some
¿sí?
synthetic cannabinoids.
Y en el caso de países
And then in the
centroamericanos,
case of
donde
Central
al parecer
American
ha bajado
countries,
producción
where
de
apparently there
metanfetamina,
is now
especialmente lo que tiene que
less
ver
production of
con
methamphetamine,
Guatemala,
especially with Guatemala.
¿cierto? Pero eso ya fue hace unos
But
años,
that was a few
afortunadamente no se
years
ha
ago, and lately
reportado
we have not had
en
any
la región,
reports
digamos,
of production of this kind of drug, or the entry of precursors for this kind of drugs. So, as I said, also there's no evidence that we do have a crisis of opioids as we do see in North America. What we see in some cases is actually a lack of opioids for medical treatments, for therapy. And I think there is a lack of that. But we have seen some trends that we will analyze later on related to the trafficking of medicine. Now, for all of the seizures, as you can see here, and if we compare them with the seizures in other continents and in other hemispheres that are maybe not that high, but are concerning as well, because apparently the dynamics of diversification of drugs in the region is increasing, but that doesn't mean that the consumption of natural drugs are going to increase. So this means that there is a complementarity of natural and synthetic drugs in the region, and that the market is actually being diversified broadly. As I said before, the countries that are seizing more drugs and where the process is more dynamic are Argentina and Chile. In the other countries, the seizures that are reported are really low. Now, it doesn't mean, like I said, that the problem is directly proportional to the seizures. But I think the problems that we have in most of the countries in the region is that, the dynamics of drugs are mostly related to cocaine. So, we are countries where most of the efforts are focused on cocaine, all of the efforts, and that thus leaving some space for other drugs to come in. As I said before, we don't really see an opioid crisis in the region. What apparently is happening is that the opioid problem in Latin America seems to be related to these media trends that have occurred related to what is happening in North America. So what we have been able to see in South American countries is the theft of opioids and some fentanyl byproducts from the hospitals and health centers to see what they can do with it, to start selling them for illegal consumption. And so now we see very strange combinations of stimulants with this kind of substances that sometimes we don't really know exactly where it comes from, or if they are actually looking for a market for these, and they know that, it has created an interest. And except Mexico, no country in the region we have seen any production of artisanal fentanyl. So only fentanyl we have seen that this is happening. And apparently this would be also being going down. And then also regarding problematic consumption, apparently it's only in North America, but north of Mexico. That's the only place where we have seen. In no other country in the region, we've seen a problem like this. And then also what we see is that most of the countries are reporting theft of fentanyl from their hospitals. And a lot of the theft of fentanyl is being done by the people working at the hospitals. They just, remove this so that they can sell it. And we have seen this, especially in the news media. Basically all of the countries in the region, we've seen reports of, people getting stealing fentanyl to resell it. And even people who are not part of a drug trafficking chain, they just think that, this can be sold and I can make some money out of it. And so they start doing that. They start stealing it. This is what's happening in all of the countries in the region. This is where we see these very strange combinations with stimulants and, just trying to look for a use for these substances. And obviously, this is going to have, naturally, this is going to have an effect in the consumer. And this can even be worse than the substance itself in pure state, because these are combinations that we don't know what can occur in the body and what they can be generating, right? And the most interesting thing I think is that in most of the cases, the consumers have no idea what they are actually consuming. It's this kind of combinations that can have quite toxic effects. So, as I said before, one of the main problems in the region is that our policies and regulations are mostly focused on natural drugs like cocaine, right? And therefore leaving the MPSs and synthetic drugs aside. And that's why justice administrators sometimes don't have enough tools to deal with this problem. It is also not clear how we deal with precursors.
No hay conocimiento por parte de las autoridades ni aduaneras, ni interdicción, ni administrativas de este tipo de sustancias, lo que hace que la región, en relación con el posible ingreso de estas sustancias para producir drogas de síntesis, se encuentre en un estado vulnerable, ¿cierto? Eso hay que considerar. Ahí eso que implica,
And
pues,
then, so what does that imply? It means that we need to develop technical capacities. So for the synthetic drugs, we need to have technology, and in most of the countries in this region, most of the authorities do not have the adequate technology, enough technology or training that would allow them to detect this kind of drugs in the timely manner. So trying to identify them, or what are the precursors. In many countries, we don't really have the ability to intervene in production areas and considering the environmental impact and the, sometimes handling these drugs, they don't really consider biosafety or anything, and that's how all of the people involved in these are very exposed. And so in the region, we are in a very vulnerable situation. Now, the authorities and the, justice administrators in the region are, they definitely base their responses on the amount of drug that they seize. And so here we are used to seizing, kilos and tons of drugs. And so based on that, they make decisions, like legal decisions. And in the case of synthetic drugs, I think we need to change that, because much of what can cause this problem is based, it's just grams, even milligrams. And it's hard for justice administrators to really address these cases with such small amounts. And so we would recommend to address this based on the price or the dose or the dangers and the toxicity of the drug, not so much the amount of the drug that they may seize or that may be produced, so that they can make legal decisions. And I think that is a consequence of always, being thinking about only cocaine when it comes to drugs. And so many of our policies and regulations in South America or Latin America, they do not talk about synthetic drugs. They don't think about NPSs. They only think about natural drugs, like I said, and especially like cocaine. And this implies working
digamos, con más frecuencia con
together
administradores
with the
de justicia,
justice
¿cierto?
administrators.
Y especialmente debido a que muchas drogas,
And
por
then
ejemplo, no
especially
encuentran dentro de
because
las
many
listas
of the
criminales.
drugs are not
Una
within
tendencia que se ha visto y
these
que comenzó
lists.
aquí en
So
Latinoamérica,
something
que
that
inició
started
aquí
in
en
Latin
Latinoamérica,
America, a
de
trend
aquí
that
pasó
started
a
in Latin America,
España,
and from here it went to Spain.
obviamente por nuestros
And
lazos
so
culturales
obviously
y todo
because of
ello,
our
y que
cultural
tuvo,
links,
digamos,
and
tomó mucha fuerza
it
debido a la
really
promoción que se
became
hizo
very strong
de los
because
medios,
it was
especialmente
promoted in the media, and
de revistas y
especially
periódicos,
in
la nueva
magazines and
droga,
journals and
lo que
newspapers that were talking
contaminaron de
about
moda, todo
new
eso.
drugs.
Así salió en algunos países de la región y así salió en notas de prensa en Europa
And
y
that's
le
how
dio un
we see it
marketing.
in
Es que
Europe.
la
And so I
región de
think
la
it
cocaína
was
rosada,
a lot of
que no es
marketing
ni
for that.
cocaína y que ahora está inclusive
And
cambiando a muchos
it's this
colores, que
pink
siempre fue
cocaine, and now
rosada
they are
y que no es una
changing. It's
droga
not always
específica,
pink.
porque como vemos acá, son mezclas de
And
drogas
as we see,
que
these are
todas tienen
combinations
la
of drugs, and all
mayoría
of
en
them,
común en
most of
común la
them,
ketamina,
have something
pero
in
que
common, which is
encontramos mezclas de
ketamine.
estimulantes,
Then
de
we also
depresores,
find a
de
combination of
alucinógenos en
stimulants
el mismo tipo de
and
medicamento
hallucinogenic
y de droga
substances,
que se
and
comercializa,
everything
¿cierto?
is
Y que está
together.
generando una problemática de salud pública en algunos países de la región, es esta cocaína rosada, ¿cierto?
And
Hemos
so pink
encontrado
cocaine is
unas
one of them.
muestras
We have
uno dice,
found
esto
some
no tiene mucho
samples that,
sentido
you
desde
can you
comenzó,
may
se
think that it
creería
doesn't
que
really make
cada
any
uno los explicará
sense,
más adelante de los
Maybe Claudia
análisis que
will
han
talk
hecho
about the
de
analysis
relación
that they have done in
precio-benéfica,
terms of
pero
this
es
kind
muy
of drugs.
interesante.
But it is
Podríamos
very
decir que es la
interesting.
droga de
So we could
síntesis de la
say that
región y
the
la droga de síntesis
synthetic
que la región ha
drug of the region
aportado
and
a la
the synthetic
problemática
drug
de
that
las drogas
this
ilegales,
region has
pero que
contributed with
en
to
la
the problem
práctica no
is
es una
this.
droga
But
en
in practice, it's
específico,
not really one specific drug.
que es un término que puede
It's
involucrar
this
muchas
is
drogas.
a
Es que ese
term that
término
may
más bien de
involve many
marketing y
drugs.
de
I think it's more of a
comercialización,
marketing
¿cierto? Y como tal ha
stunt,
funcionado muy
marketing
bien.
stint,
Entonces,
and I
ante
think it
eso,
has worked
pues,
very
lo
well.
que nosotros
So it's
sugerimos es que
interesting
las
what we
normas sean más
suggest
amplias,
is
que las
that
normas
the
se
policies and
actualicen,
rules
¿sí?
are
Que se
better,
trabaje
broader,
más
that they get updated,
en
that they are
análisis, en
revised, and that
estudios
they
que
work on
manejen, digamos,
analysis and
precios,
studies.
mercados, dosificaciones, peligrosidad, potencia adictiva, todo lo que tiene que ver con ese, y que se capacite especialmente a las autoridades y se les dé tecnología
And
para que
that
puedan tener un manejo
they
oportuno
can
de lo que se podría estar
say
consumiendo o
they
lo que
can
están
do,
consumiendo en
or they
nuestra
can look at
región.
what is being actually
Que
consumed in
comiencen a
our
trabajar de
region.
manera
And
más
so the
organizada
justice
las
administrators need
autoridades
to work
educativas y
together.
preventivas
All of
con
the
autoridades de
justice
salud.
administrators
La
need to start
mayoría
working with the
de
health
digamos,
sector, with the
del
other
trabajo
sectors also,
técnico
because
que se
most of the
realiza
technical
aquí
work that is
es
being done
independiente. Lo
here
hacemos
is
por un
very
lado y
siloed.
los
So,
operativos y los directivos por otro
health
lado, los
sector
forenses
works on
se
the one
preocupan
hand,
unos
and then the
para
justice
otro lado,
administrators on the other
tomar
side, and then there's
cada
people in the
uno por
middle
su
that they
lado.
don't
No hay
know
una
who to
coordinación
work
muy
with.
específica que se hizo.
There's no coordination.
Por darles un ejemplo,
And
en
so
la
just to give you
mayoría
an
de los
example, in
foros donde
most
nosotros
of
estamos
the
nunca hay un médico
forum
toxicólogo. Muy
where
raramente hay
we
un médico
work, there's
toxicólogo.
not
Y
a
si le preguntamos a
toxicologist.
la
And so if
mayoría de los
we ask
médicos
most of the
emergentólogos de
doctors,
pronto qué es un
the
NPS,
emergency
seguramente
doctors,
no va a tener
what an
ni
MPS is,
idea de qué
probably
es
they have
eso
no idea what that is
o cómo
or how
trabajan eso. Hablan
to
de región
manage that.
y de
And
manera general,
so,
no en casos específicos
maybe there's
donde
specific cases where they do
necesiten.
know, but
Por lo
mostly they
tanto,
don't.
hay que
Therefore,
trabajar
we
con
have
mecanismos que
to
permitan
work
salir de
in,
esas
on
listas
mechanisms
a
that will allow
mecanismos,
us
digamos,
to have
más
mechanisms
eficientes
that are more
de
efficient
control. Esto en
for
líneas
control.
generales
And so this
era
is
lo
in
que queríamos
general
compartir, ya
lines.
una
This is what I
discusión
wanted to share with you. And maybe
digamos,
then when we
interna
have the
que no
Q&A,
ampliamos
I
muy
can
en el tema que tiene que ver
talk
con esto,
more
porque es un
about
tema muy
something
complejo, es
or
un tema
another. But
que
this is a very complex topic.
incluye
It's something
muchas
that
dinámicas
includes
y
also a lot
muchas
of,
facetas y depende de si es
angles
desde lo
and
administrativo, desde lo
facets, and
operativo, desde lo
it depends
interventivo,
on
desde lo
if
forense,
you
desde
look
lo
at it from the
toxicológico,
operational
por cada uno de
or
los lados tiene sus
administrative. And so
problemáticas
each
y
angle
es muy
has its own
interesante
problems, and it's
que
very
se pueda
interesting.
abordar aquí de una manera integral. Muchas gracias.
Thank you.
Muchas gracias, estimado Magíster Bernal.
Thank you,
Ha
Mr.
sido una
Bernal. It
presentación
has been
sumamente
a
interesante.
great and interesting
Em,
presentation.
Como un breve resumen de lo presentado, eh, suena alarmante la información compartida acerca de que en varios países de nuestra región se está viendo que funcionarios comercializan ilegalmente el fentanilo con fines lucrativos, ¿no? Si bien es cierto, no forman parte de una red criminal, de todas formas influyen mucho en la comercialización, ¿no? Otro mensaje importante que compartió
Another important
Mr.
message
Bernal
that
fue
Mr.
que
Bernal
los
shared
países donde
is
se
that the
concentra el
countries
80% de las
where,
importaciones de drogas
80%
sintéticas en nuestra
of
región
the
son Argentina y Chile.
synthetic drugs are
Entre
seized
estos,
in our region are Argentina and
estas
Chile.
sustancias son el éxtasis
So,
y la
and
anfetamina.
among the substances are
Y
methamphetamine
dentro
and
de las
ecstasies. And then also within the recommendations
resultantes de su presentación
from his
sería
presentation
la importancia de potenciar tanto
are
las
the
tecnologías
importance
y
of
capacidades técnicas
having
para la
capacity
vigilancia,
building and
detección
having better technology
e
for the
intercepción
detection
y análisis
and
forense de las
introduction and
drogas
forensic analysis
ilícitas,
of new
la
synthetic drugs.
fiscalización de la distribución
The
y
also
venta de
supervision and
sustancias
oversight
tales
of
como el fentanilo,
distribution of opioids like
el trabajo
fentanyl,
intersectorial
the
entre
intersectorial
administradores de
work between
justicia,
the different
autoridades de
justice
supervisión,
administrators,
expertos forenses y
healthcare
el cuerpo médico,
professionals, and
y
other
la
experts,
actualización de listas
and
de
then
drogas
also
y
the
sustancias
revision and updating
controladas.
of drug lists.
Nuevamente, muchas gracias,
Again,
Mr.
thank you
Bernal.
very
Le
much,
pedimos
Mr.
mantenerse en
Bernal.
la sala,
We
ya
would like
que han
to request you
llegado
to stay
múltiples
here
felicitaciones,
because we
comentarios y
have gotten
preguntas
congratulations and questions and
que
comments for
le
you that we
solicitaremos
will
responder al
address
final de
later
nuestro
during the
webinar.
Q&A.
A continuación, le damos la
Next,
más
we are
cordial
going to give the
bienvenida
floor
a Claudio Vidal.
to Claudio Vidal.
Él es licenciado
He
en
is
psicología
has
y
a
experto
degree on
universitario
psychology
en
and an
metodologías de
expert
investigación
on
en
research
neurodependencias
methodologies
por la Universidad de Málaga.
by the Malaga University.
Inició su actividad profesional en
He
el
started
ámbito de las
his
adicciones en el año
professional
2001
career in
con la puesta en
2001
marcha de
with
varios
the
proyectos de
implementation
reducción de
of
riesgos
several
y daños del
projects to
consumo de
reduce
alcohol,
risks and the
otras
damages
drogas
done by
y la
the alcohol
conducción
consumption,
de vehículos.
consumption of other drugs,
En los
and
programas Saber
driving under
Beber,
the influence.
Segura
In
y
the
Arriesga
programs, knowing how to drink, Safe
y
Night,
Te
and Reduce Your
Arriesgas.
Risks, and You Risk
Esto
It.
dentro de la asociación
This
Grupo
within
Procambio en la
the
provincia de
Asociación
Málaga.
Grupo Procambio in the Malaga province.
Ha tenido múltiples
He has had
participaciones
different
en diversos
participations in different programs
relacionados a
related
primero
to
mencionado.
these
Asimismo,
program that I
ha
mentioned
formado
before.
parte
He's
como
also been
investigador en
part
varios proyectos
of
relacionados con la
many projects
reducción
as
de
a
riesgos
researcher
y
to
daños en
reduce
personas
risks
que
and
hacen
damages in
un uso
people
recreativo de
who
drogas,
do
tanto
use
desde el programa
recreational
Energy
drugs
Control
from Energy
como
Control
en
Program,
colaboración con la
as well as
Universidad
in
de Huelva,
collaboration with the
habiendo
Huelva
presentado sus
University,
resultados en
having
revistas científicas
communicated his
nacionales
results
e
in scientific
internacionales,
journals, both
así como en
domestic and
diferentes
international,
informes
as well as
de
in different
investigación y en
research
congresos
reports,
nacionales
and
e
also
internacionales.
in congresses
En el año 2016 y también en el
internationally and nationally.
2017 fue miembro del grupo
In
asesor de
2016
dos
and
informes del
2017, he was a
Observatorio
member of the
Europeo de las
advisory group
Drogas
of two
y
reports
las
for the European
Toxicomanías.
Observatory on Drugs and Toxi and
Es un honor también contar con su participación,
it is an honor
Claudio
to
Vidal. Le
have
damos
your
la
presence.
palabra y el
So
uso.
you have the floor.
Muchas gracias, Ruby, por
Thank you,
la
Ruby,
presentación.
for the introduction.
Y, bueno, buenos días
Good morning,
a todo el mundo.
everybody.
Dar las gracias
Thank you
a la
also.
organización de
Thank you to
esta interesante
Orasconu
iniciativa, de
for
este webinar,
organizing this webinar and inviting me.
felicitarles
And
por
congratulations
felicitarles por ella.
also for this webinar.
Y bueno, y sin más
And, well,
dilación,
I
pues,
think without further ado,
si os parece, voy a compartir
if you think it's,
presentación.
suitable, I will share my screen.
¿Se ve bien? Quizás podríamos ponerlo en modo presentación.
Ahora, ¿no?
Excelente.
Bien.
Listo.
Perfecto. Bueno, bueno, antes
So
de
before
comenzar, pues,
starting,
bueno, sí vengo de parte de
I would like to say that I am
Riod,
here on
pero
behalf
soy
of
director del programa de
Riod, but I
Energy
am
Control de
also
la
the
Asociación de
director
Bienestar y
of
Desarrollo,
Energy
que es
Control and the Bienestar and Desarrollo
programa de
Organization.
reducción
This
de
is a
riesgos
program
y daños
to reduce risks and
que está
damages
funcionando en
that
España
is
desde el año
working in Spain
97,
since the year
que
97.
fundamentalmente
And
pone a
fundamentally, it
riesgo los
works on
consumos
consumption, recreational consumption of drugs.
sobre todo que son consumos
Especially these are, it's consumption that occurs during the weekend, or, it's very specific for recreational spaces. And specifically, Also, the energy control program. We work also with, electronic music and dance, and fundamentally because these are spaces where we know that gather people who show patterns of consumption of these drugs, qualitative and quantitatively different from the ones that we can find in other areas and backgrounds. There's a big variety of substances where many of the, where we see many of the markets actually are reflected here. And so for us, it represents a priority for our work for interdiction. This also makes us work with people, especially young people, with gender diversity, and without any vulnerability factors that may be relevant. So we work with people who are middle class. They party, during the weekends, and they consume a big, and broad number of substances. So in my presentation, I have like two parts. The first part, I will talk about a brief snapshot of the current situation in Spain. And at the same time, it's also a reflection of a situation that occurs everywhere in Europe. So I will talk about among the synthetic drugs, what are the main phenomena that we can see in these years. And then a second part of my presentation, I'm going to share how from the civil society we have been trying to respond and address to these situations, especially through the articulation of the analysis services, analysis of all of these substances that, as you know, these are all tools to look at the damages, but also they allow us to monitor the markets and allow us to present some advantages regarding other sources of monitoring that we have of these markets. And then finally, also I will finish with what we have been working throughout the years and some of the challenges that we have also ahead of us. So we started with the situation, also with the situation in Spain, and for Europe, in terms of synthetic drugs, maybe unlike Latin America, here we do have quite specific markets. In the case of MDMA or methamphetamine, we know that most of the production is actually based on the Netherlands and Belgium, and we know that they export also to the rest of the world. And for a long time, we knew that these are quite consolidated markets. Also, Dr. Bernal has talked in his presentation about this. We have the markets of the new psychoactive substances, like NPSs. And especially in 2009 in Europe, it has had a lot of important developments. So in our case, and even though when we look at it regionally, we find that, for instance, synthetic cannabinoids is one of the most important groups and the ones that we have identified the most. In our case, we have the phenethylamines and the synthetic ketamines, and these are substances that are actually very used in these recreational spaces of the population that we usually work with. And then also another phenomenon that we have been witnessing for some time now, maybe over a decade now, and actually in 2014 we published the first paper documenting this phenomenon, which is the use of the new NPSs as agents that tamper with the original ones. In the cases of MDMA and also LSD. So especially when there is a drop in the availability of ketamine, they also use these adulterants. Now, a recent phenomena, these are recent phenomena that are also concerning for us. On the one hand, it's the European context where methamphetamine, it's always been absent. In the case of Europe, the main methamphetamine that has dominated for a while is amphetamine. So the amphetamine sulfate, and then methamphetamine had a very low presence. We also know that in the Netherlands they have also reconverted these
en colaboración con los grupos de crimen organizado holandeses, que si bien es una producción que se piensa destinada a la exportación, sobre todo al mercado asiático, sí que hay una parte de esa producción que parece quedarse en
we know that there is a part of this that apparently stays in Europe.
Que una parte de la metanfetamina también se importa fundamentalmente de México, pero, por ejemplo, en los últimos meses pues se ha tenido constancia porque se han desmantelado algunos laboratorios de síntesis de metanfetamina. En la actualidad, la metanfetamina, el consumo de metanfetamina parece confinado a ciertos grupos muy concretos, especialmente donde más estaría ahora mismo concentrado es en el grupo de hombres que tienen sexo con otros hombres y en el contexto de las fiestas de chemsex. Y el segundo fenómeno que también el doctor Bernal ha estado comentando es el fenómeno del TUSI. Aquí sí que desde Energy Control hemos sido muy activos en los últimos años pues para desterrar ese calificativo de cocaína rosada, cocaína rosa. Coincido totalmente con él en que cuando hablamos de TUSI en realidad estamos hablando de cómo de fácil es introducir una nueva o un nuevo producto, en este caso, en el mercado, con un nombre atractivo y sin duda alguna con la importante contribución no solamente de los medios de comunicación, que sabemos que el tratamiento sensacionalista con el que tratan los temas relacionados con el consumo de drogas, estamos habituados ya a ese tratamiento
We are
sensacionalista.
used to this treatment, but also it shows how, from the law enforcement agencies and all of the state agencies has contributed to a lot of the confusion that exists about this product. At least in Spain, the main source of these information is the news releases from the civil guard and the police force, and then the press releases, we see that there is a confusion because I think this also talks about this, debate that at some point we could have about the quality of the information that is put out there, that is communicated by the law enforcement agencies. So mainly what we have been seeing in the past few years is that when we talk about TUSI, it's this product. TUSI, it's mainly ketamine, and 90% of the cases of, ketamine, it's MDMA plus ketamine. In some cases, mainly maybe a little bit less than half of the samples that we have analyzed, we see that there is presence of caffeine or presence of other substances in our context. And so that is quite anecdotal. So when we have seen maybe one probably is a synthetic catenol. So as threats that we can see and that, right now we see that they are actually being dealt with and addressed by the authorities and the civil society is this increasing demand of the benzodiazepines and also the presence of benzodiazepines in the market, because also this presents a double threat. One, because we're talking about substances that synthetic drugs that are quite recent, where we have very little information, and then also because this is a market where adulterations and tampering, it's usual, and especially when they are replaced, they use one substance replaced by another. And then, of course, the threat of the new synthetic opioids. And we have been very active in trying to, stop talking about just fentanyl. Not only because, as Dr. Bernal said, that in the end, fentanyl has turned into a catch-all phrase where, it's everything. But in Europe, what we see is that more than fentanyl in the past few years, what has increased is the detection of new synthetic opioids, and especially nitazines. And so threats are there, mainly they exist, and we also know that the main supplier of heroin in Europe is Afghanistan, and currently it is in a, they have a ban in the growing of poppy. We don't really know what the repercussion this will have on the European Union, but there are some people saying that there could be a replacement of heroin with other, new synthetic opioids. So, well, there's also other reports that are actually more down, are more grounded on the reality. And so whatever happens, definitely it is a threat that we are monitoring very closely. Talking about these synthetic drugs like ecstasies or MDMA, what we have seen in the past few years is that there's been an increase in the production that has then translated into purity levels that are currently in their historical maximum levels. When we talk about MDMA, we need to make a differentiation. Definitely, we need to make a differentiation between the two main formats, which is MDMA can be in crystals, and then it can also be in pills. And so what we have seen in the past few years is that they have patterns. There's patterns of adulteration and purity that are different. In the case of the crystals, we see that there is a big stability in the past few years in terms of the level of purity, and especially since 2018, 2019, they are, the levels are over 75%. And then in the case of the pills of MDMA, we see increases in the average dose that is measured in milligrams per pill. So in the year 2015, we saw from a average dose that are between 75 or 80 milligrams per pill. And this was the average dose, but now it has been escalating. In 2022, apparently there was a decrease, but then it has gone back up. And just to put this in context, these doses, just for you to have an idea, a usual doses for a person with an average weight, usually these doses are between 1 milligram to 1.5 per kilogram. So for a person who, I don't know, who's 70 kilos, a 70 milligram pill will make the person to really, enjoy the effects. However, the average doses that we are finding can exceed these, even be twice as much. and in sometimes can be 3 times as much or even more. And so it has been increasing in the past few years, the number of pills that exceed the 250 milligrams per pill. And even in the past few months, we have seen some pills with over 300 milligrams per, pill of MDMA. And therefore, this is definitely a risk and a significant risk for people and for people's health. We've also seen that people who consume these substances, they have learned about the importance of dosage and how they need to split, how they need to, fraction the pills. But we, of course, have those people who are the beginners. They just start consuming and they don't have the experience, they don't have the information, and they are the ones that are more at risk to have, negative consequences related to this. So in this graph, you can see, the presence of NPSs in our analysis. You can see the dynamics that we have seen and been observing in other countries. And so, Dios mío, we can see that in 2016, we have seen that, over 450 samples of NPSs. Just to give you a little bit of context, in the past few years, we have seen 191 different NPSs, and mainly these are phenethylamines and synthetic catenones. The market of the synthetic catenones also has had an important transformation in Europe. Traditionally, the synthetic catenones were bought abroad, especially in China. But in the past few years, we've seen the presence of labs also, production labs, specifically of synthetic catenones, and especially in Poland. And this has made their presence increased in the market. And so here, what I'm showing is this phenomenon that I was talking about before. Since 2014, we have been documenting the use of new psychoactive substances as adulterants of the traditional ones, especially for MDMA. MDMA, even though it is, we have a purity that is at the maximum level, but we also see that adulteration is not as common. And so when it happens, it's usually adulteration by replacement with synthetic catenones. So it's not the only market where this phenomenon is happening. We've also seen it for LSD, where where there is adulteration. They also do it by replacement, and they usually do it with psychedelic phenethylamines like DOG or DOX. And these are amphetamines, but they do have it's more of a psychedelic effect. Or in the case of ketamines, we see analogs of ketamine where there is less ketamine in the market. And when this happens, they start using NPSs to, continue filling the demand. So when we think about this, the civil society for many, many years now, we started working on analyzing the substances. And these services have a dual mission because on the one hand, they are tools to reduce damage, when we work with people that are consuming these psychoactive substances. And so we provide help and support and accompany them through the analysis of the substances that they are going to consume. And this also allows us to monitor the drug markets, and especially those places where these services are implemented. This monitoring is then fed by all of these samples that people deliver in a voluntary manner. So, to be able to receive this advisory, all of these data, they have to be compiled and shared, as we will see now. In Europe, the different services, the different analysis services became a network, which is the TEDI network. And currently, and I'm sorry that I am using a map that is not completely updated, but currently we have 24 organizations that are part of the TEDI network, which is a Trans-European Drug Information Network. They are scattered all throughout Europe, and we see that the coverage of this analysis services is quite good and big because they are applied in different countries in Europe. Most of the organizations belong to the civil society, the SRCSOs. There's also a private entity working in the government area, and especially we also have important contributions by the academia. The TEDI network basically is focused on 3 major groups of work or lines of work. First,
Dr. Bernal hacía énfasis en esta
Dr.
cuestión que es
Bernal
muy importante.
was talking about this, and it's something important. The new substances, the new psychoactive substances,
todo lo que tiene que ver en su identificación, en su caracterización.
Looking at characterization, it's important, and so it is important to constantly develop more methodologies and also develop methodologies that have to do with the provision of the services themselves. So let's, think about this, that when we think about a lab, analysis lab, we are thinking about conditions that are completely standardized, where everything, is happening. But when we talk about analysis services, we're talking about markets where the substances that are going to be analyzed do not just come by themselves and pure. What we want is to analyze different compositions, different combinations of substances, and these poses many methodological pieces of information.
No solamente tienen un laboratorio, ¿no? Que hay un laboratorio, por ejemplo, de respaldo con cromatografía de gases, etcétera, etcétera, pero también estos laboratorios y en formas pues, más reducidas, con técnicas pues más de detección, de pruebas rápidas, etcétera, se trasladan a los propios espacios de ocio para poder estar en los momentos y en los lugares donde los consumos de sustancias tienen lugar, ¿no? Y por lo tanto, esto también implica importantes desarrollos metodológicos y es la red en la que trabaja de manera colaborativa pues, para poder producirlos. También se trata de compartir la información y estos desarrollos pues, con toda la comunidad, fundamentalmente la comunidad académica y comunidad profesional. Aquí les pongo un ejemplo pues, de este artículo, ¿no? Pues que tras el análisis, ¿no?
Here's an example of a paper, an article that after analyzing different samples of cannabis, that had a very low content in THC, but they were adulterated with the synthetic cannabinoid receptors. And so in my presentation, I am also adding some links, and you can get to know more in depth the work that the network does. And then finally, just one of the big points of the TEDI network is that, given the big amount of information that is compiled, it's the creation and maintenance of databases and their, availability. We can put them available to the European Observatory that for many years they have been incorporating all of this information that come from the analysis services in their annual reports about the situation of the drug markets in Europe.
Bueno, y por ir finalizando mi intervención, pues sí que hablarles de una valoración, ¿no?, de los avances que hemos ido haciendo en estos años y algunos de los retos que tenemos por delante. Con respecto a lo primero, pues quizá la principal, ¿no?, conclusión que podemos sacar de todos estos años es que hemos sido capaces de consolidar los servicios de análisis fundamentalmente como herramientas de monitorización y además como herramientas de monitorización que presentan una serie de características distintivas con respecto a otras fuentes de monitorización de los mercados, ¿no? Y de los consumos en general. Primero, pues porque se tratan de herramientas de monitorización que se basan en la confianza y en la proximidad con las personas usuarias. Antes les decía que las muestras son entregadas de manera voluntaria por las personas que van a consumirlas y eso implica que hay que establecer esa relación de confianza y de proximidad con las personas. Este contacto directo con las personas también nos permite analizar discrepancias, ¿no?, y conocer en profundidad esas discrepancias entre lo que la persona cree que va a consumir y lo que realmente luego tiene entre manos para consumir. Y esto hace que también tengan un componente preventivo que no tienen otras fuentes de información, porque en el momento, primero porque analizamos antes del consumo, muchas veces, y porque cuando ese análisis da como resultado algo que no corresponde con la expectativa que traía la persona y se acompaña de un mensaje de no consumo, en el 95% de los casos la persona no lo va a consumir, ¿vale? También nos permiten acceder a mercados minoritarios y a los que es de difícil acceso a través de otras fuentes de monitorización,
We can
¿no?,
also have
especialmente
access
los
to
mercados
other
de
uh,
sustancias alucinógenas,
markets like
los mercados de
hallucinogenic
LSD, por ejemplo,
substances, or the
con
LSD
NIH,
markets
que
that are,
contamos
it's very
también
hard
con
to
mucha
access, and we
información,
have very
pues
little
como el
information
mercado
on them, and
de
also
drogas
the,
también. Y
NPS
luego también lo que
markets.
tiene
And then
son
another
escalables
advantage is
en
that they are
función
scalable to different
de los
contexts.
servicios de análisis
The
se
service, the
desarrollaron en el
analysis
ámbito de reducción de
services
daños en el ámbito de
uh,
los consumos recreativos, pero
focused
actualmente
on the
se está
recreational
trabajando
aspect, but
también en la
currently
aplicación de
we
servicios
are
de
working on the
análisis
implementation of the analysis services in
campestres,
different campsites
o
contexts,
también
for
en salas de
instance, or
consumo
also in other
supervisados, con lo
consumption
cual
rooms that are
son
supervised.
escalables pues, a
And
estos otros
therefore,
contextos
this is
que son
scalable to
comunes
other
a todos y que
contexts
tienen
and
otras
other services
poblaciones.
that
Y para terminar,
serve
pues
to other populations. And then to
retos que
finish,
tenemos,
some
bueno, unos retos
challenges that we
presentes
have.
siempre.
uh,
Es que cuando hablamos de mercados de drogas estamos hablando siempre de mercados
that's about.
cambiantes.
So when we talk about
Son mercados que hoy
drugs,
son
these are
aquí,
ever
pero nada nos
changing
asegura
markets,
que mañana
and these
no
are
vayan a ser
markets that are
así. Y
one
de esta
way,
amenaza
but
real
it
pues
doesn't
tenemos
really
evidentemente
mean
una
that they will
sociedad
keep that
destruida
way.
por ese elevado
And then
consumo
obviously we
que
also have the
también
synthetic
puede
opioids.
generar daños, como hemos
So
estado viendo en
it's
Norteamérica.
because of the potential that we have
También como reto
of the
esta
damage.
especialización del equipo
And then
médico,
also as a challenge, we have the
realmente
specialization
el
of
hacer
the
frente a los
human
mercados requiere un nivel
resources.
alto
Definitely to
nivel
face these markets, we need a very high
especialización,
level of
y que
specialization.
hace falta mucha formación
And
continuada, hace falta
it
mucho
is needed to
establecimiento de
have a lot
redes
of training
y hace falta muchos
to
sistemas de
create
información que
networks, and
permitan
we do need a lot
comunicar la
of
información
training
de la manera
programs and
más ágil
systems
y eficiente
that will
posible.
allow to
Por supuesto, el
transfer the
desarrollo de las
information
nuevas
as
tecnologías
fast
que
as
al final
possible.
nos
And then,
remiten
of
a la
course, we also
innovación.
have technology
Vivimos en una
that
época
allow
donde
us
también
to
hay una
share this.
crisis de
There is, of
financiación
course, a
muy
crisis, a
importante en los
financing
últimos
crisis.
años y por lo tanto los servicios de análisis no están exentos también de estas dificultades de financiación. Y finalmente también tenemos como reto a nivel global es la articulación de la sociedad civil
And
en
then
la
finally, we
monitorización de estos
also have
servicios.
the
Se
participation
vienen creando sistemas
of
de
the
alerta
civil
temprana en
society.
numerosos
We have been creating
países.
early warning
La investigación
systems.
que hacemos es que en estos servicios de alerta o sistemas de alerta temprana también debe contarse con la participación activa de la sociedad civil. Y nada más por mi parte, quedo a su disposición para aquellas cuestiones que quieran plantear. Muchas gracias.
Muchas gracias, estimado licenciado Vidal. Ha sido una presentación sumamente enriquecedora. El experto Claudio Vidal nos
Thank you,
recalcó la
Mr.
gran
Vidal.
responsabilidad de
And
los
so
medios de
he has talked
comunicación que
about the
tienen
big
a
responsibility of the
lo realismo al
media,
presentar noticias
who
relacionadas con
tend
estas
to be more
nuevas
sensationalist
sustancias
when they
psicoactivas.
talk about these new psychoactive
Asimismo,
substances.
alertó sobre la elaboración
Likewise,
de
he
drogas
talked about
sintéticas
the
cuya
elaboration of synthetic
presentación
drugs
de oferta
and the
difiere de los
presentation of
reales
which are
componentes en los que se
different
producen,
from the components.
algo que resulta alarmante desde el abordaje clínico ante casos de consumo o
He
sobredosis.
also talked about the
Asimismo,
clinical
mostró la
approach,
experiencia
and then
significativa
he
de
talked
la
about
cooperación
the important
internacional
experience that
la red
exists in
TEDI,
the
donde
cooperation in the
se
TEDI
realizan
network,
análisis de drogas
where they
disponibles en
conduct
espacios de
analysis of
ocio
drugs that are
casual y
available in
adulto,
recreational spaces
y
for
que a
young
través de
people
esta
and for
estrategia se
adults.
contribuye a
And through
la
this strategy, they
monitorización de los
contribute
mercados
to monitoring
tabáquicos
of the
y las
different
composiciones
markets
de
and
las
the
nuevas drogas,
compositions of the new
siendo
drugs.
así una estrategia
And so
clave para
this
el
is a
desarrollo
key
de las
strategy
tecnologías
for
y
the development of
capacidades técnicas
technologies
para la
and
vigilancia,
capacities
inspección
for
y
the monitoring,
interdicción y
inspection, and
análisis forense
interdiction
de
and
las
an
nuevas
forensic
drogas
analysis of
sintéticas,
the new
y es algo
synthetic
que
drugs.
también
And this is
mencionó
something
el
that
magíster Bernal en su
Mr. Bernal
presentación. Entonces
explained
se
during his
complementan muy
presentation.
bien
And so
ambas
definitely both
presentaciones.
presentations
Muchas
are quite
felicitaciones, experto Claudio Vidal,
complementary.
por su
Thank you very much,
disertación.
Mr.
Le
Claudio
pedimos mantenerse
Vidal.
en sala
We
porque
would
han
like to request you
llegado
to
felicitaciones,
stay
comentarios y
here
preguntas.
because we have
La verdad
gotten
es que han llegado
questions
muchas
and
preguntas.
comments. We've gotten a lot of
Ahora
questions, really.
vamos a dar un espacio de
So now we're
agradecimiento a las
going to
personas conectadas.
thank the people who are connected,
Agradecemos
who
a
are
todas
logged
las
in.
personas
We would like to
conectadas de los
thank
ministerios de salud,
everybody
la
who is logged in from the
academia,
ministries of
diversas
health, the
entidades y
academia,
organizaciones
different
sociales
entities and
de
organizations from
Argentina,
Argentina,
Colombia,
Chile,
Cuba,
Colombia,
Ecuador,
Cuba, Ecuador,
España,
Spain,
Guatemala,
Guatemala, England,
México, Nicaragua,
Mexico,
Paraguay,
Nicaragua,
Perú,
Paraguay,
Uruguay,
Peru,
Venezuela,
Uruguay,
entre otros.
Venezuela, among others.
Hemos recibido
So we have gotten
muchas preguntas, como les
many
mencioné, y
questions,
también
as I said,
felicitaciones
and a
por
lot of
excelentes
congratulations
presentaciones.
for the excellent presentations.
Y vamos a pasar
So
al
we
espacio
were
del
going
diálogo.
to
¿Les parece?
have, I think
Para
we
iniciar
can
este
move on
diálogo,
to
a
the
partir de
Q&A.
las preguntas
To start
formuladas,
this,
les pediría a los ponentes
Q&A
que por
based on
favor
the questions that
enciendan sus
were asked, I would
cámaras.
like to ask the speakers to please turn on your cameras.
Durante el desarrollo del
During
webinar,
this webinar,
nuestros participantes
our the
han
attendees
manifestado
and
sus
participants
inquietudes y haremos
have
lo posible por responder a la
issued a few
mayoría de
questions,
estas.
and we're going to try to
Después
answer them
tenemos
all.
preguntas que
So we
son
have some
para ambos
questions that are
ponentes,
for
y
both,
quizás al
and
plantearlas a
maybe
ambos
when
también
we
podamos
ask
tener un espacio más
these to
enriquecido
both, we
de
can
diálogo,
have
¿no?
a better dialogue.
La primera pregunta
So the
es,
first
¿cómo
question is,
trabajar con los
how
medios de
can we
comunicación
work
para
with
hacer
the media
prevención
in
y
order
no
to
promoción de las
prevent
drogas?
and not to promote drugs?
Quizás podemos comenzar en el orden
Maybe
de
we
las
can
ponencias.
start in the same order as you
Claro,
presented.
sí, es muy importante. Y
Yes, it is
como
definitely
alguien
very
dice,
important.
digamos,
And as I said
ese
before,
resto de
that
un
we,
ejemplo claro del de
and we gave the clear
Tusi,
example of the
cocaína rosada,
Tusi and the
como
pink cocaine,
los medios en
as
muchos casos
how the media in many
terminan
cases,
magnificando la problemática y
they end
terminan
up
haciéndole, digamos, marketing a ese
making
tipo de
the problem
drogas.
bigger and
También
actually
estudios que se hizo
doing some
hace
marketing to these
tiempo,
drugs.
se
And
evidenció que
so
después
we
de esas,
saw that
de esas
after all of
noticias,
these news that came
digamos,
out in the
amarillistas
media,
relacionadas con drogas, al otro día se
the
incrementaba
next
inmediatamente
day we
la
saw
demanda
that there was an increase
de
in
la
the
sustancia
demand of
presente
the
dentro de la noticia.
substances.
Y eso determina
And that
necesariamente una responsabilidad grande, no
necessarily
solo
means
de
that
los
there is a
medios de
big
comunicación,
responsibility, not only
sino
of
de
the
las
media,
instituciones
but
y de
of
los
the
organismos
institutions and the organizations
o de las
also,
organizaciones donde
of the
se
organizations
trabajan
where,
estos temas para
they
desarrollar,
work on
diseñar y
these to
desarrollar
develop
mecanismos que
the
permitan
mechanisms that will
de
allow,
manera coordinada, de
in a
manera
coordinated
sinérgica
manner and with
con los
synergy,
profesionales de la
that will allow
comunicación,
to have
establecer
work with the
mecanismos
communication
que si
professionals.
bien
We
no
should establish
limiten la difusión de las
mechanisms that
noticias,
will maybe not,
se haga de
limit
una manera
the
más adecuada
news, but they will, they
que
can be more
no
adequate and they can
implique
be better. That will
necesariamente
not
la
necessarily imply
promoción
the
de drogas. Es
promotion
decir,
of
eso
these products.
determina una
And so I
responsabilidad
think this
compartida,
will determine
obviamente,
a shared
entre la
responsibility,
institucionalidad,
obviously
las
between the
organizaciones y los medios de
institutions,
comunicación.
between the media and the institutions.
Bueno, es una pregunta
Well, I think this is a
muy
very
interesante
interesting question, an important
y
question,
además
and
tiene una fácil respuesta.
also doesn't really have a
Lo que
good
creo que
answer or
debe
an easy
quedar
answer.
claro es que hay una parte
And so there is a
Importante ser
also
justos, en este sentido y no meterlos a todos en el mismo saco,
I don't think
¿no?
we
Y hay
should
medios de comunicación pues, que sí hacen un tratamiento pues, más o menos adecuado. A lo
say
mejor se
that all
podría
of them are
pedir
the
un
same. You
poco
know, some media outlets
un
are
tratamiento adecuado,
definitely
pero luego hay otros medios de comunicación
some
que
media
puede
outlets
ser
definitely
el
uh,
tratamiento
have a
sensacionalista
very good treatment of these, but there's
de
other
los
media outlets where
fenómenos,
they are very
fenómenos
sensationalist,
sociales,
and you
forma
know
parte de su
of the
business,
many
¿no?
social
Viven
phenomenon. It's part of their business, and that's
de
how they
eso
live
y son
off. They live off
para
that,
eso, ¿no?
and
Entonces,
so and for
todo
that.
está
So if we take this,
partiendo, ¿no? de esta
and we start
situación
from this,
que nos hace difícil el
it's
encontrar
hard for us
situación
to really find a
o
situation
posibilidades de trabajo.
or
Por una parte,
possibilities of
yo
work.
creo que sí que es importante
And so I think it
pues
is definitely
seguir
important
trabajando con
to
estos
keep on
medios
working with
que
these
realmente sí apuestan por
media
una
outlets
información veraz,
that will definitely
seguir
have a very
rigurosa,
serious and
etcétera,
truthful
y
and
hay muchos
rigorous
profesionales
delivery of
que
information.
realmente
And there's
desean
professionals also that
dar
really
estas
want to help
informaciones y por
and
lo tanto hay
contribute
que
to
potenciar
to the
estas
situation.
alianzas
And therefore, I think we need to do that. We
con
need
estos
to
profesionales
foster
y,
partnerships with this kind of good
por otro lado,
professionals. And
seguir
then on
trabajando en
the
la
other hand,
denuncia
we need
y
to,
observar malas
still
prácticas
report these
en el
bad
ámbito
practices,
periodístico,
if you
no
wish.
solo porque
And not only
den canal a la
because they
difusión
will
de nuevas
be used as the
sustancias en las que dar a
channels,
conocer
to
estas
disseminate
sustancias que hasta ahora no hubieran conocido
the information about
nunca,
new
sino
substances,
también porque, y
but
quizá
also,
desde nuestro punto de vista más
and maybe
preocupante,
even more
porque
concerning,
acaban
because,
estigmatizando y
they
reforzando
end up
falsos prejuicios
stigmatizing
sobre las
and
personas
reinforcing
hacia las
these
personas
stigmatization processes
ofreciendo una
against people who
imagen
use this, and
absolutamente
they give
estereotipada,
images that are completely
siempre
stereotyped,
con
or
atributos
they
negativos,
are
y esto
always
lo ha
having
estado
negative
viendo ahora
attributes. And this is
con,
something that we have seen now
con la crisis de
with
sobredosis en Estados
the
Unidos, cómo se ha
overdose crises
representado
and how it
el
has
resto del
been
mundo y
represented,
estas
the rest
imágenes
of
de
the world with
barrios,
these
de
images
personas
of neighborhoods and
consumiendo en
people
la
that look like
calle,
zombies,
etcétera, etcétera,
and
nos
shooting
han
in the
estado haciendo
streets. And
también
so of course they have been
sentirnos
reproduced
¿no? Sin pensar
without
suficientemente.
really
Esto
thinking
ahora se ha
critically of
reproducido
these
también
people, and
en
then this ends up
redes,
being
pues hablamos
reproduced at
de
many
la
levels.
droga caníbal, que
So
si la droga Superman,
so
que si
we
la
say that
droga,
the can like
siempre
Superman drug or
buscando esos
cannibal
atributos
drug, or
sensacionalistas que al
they are
final
always using this
lo que acaban es reforzando
sensationalist attributes. And in the
estigmatización
end, they end up
en relación
reinforcing
a las
negative
personas que
stereotypes
usan
about
estas
the people who
sustancias,
use these drugs.
que el peso del estigma
And
sobre
we know
estas
that
drogas
stigma is a very
sí que
big
es
one
algo
and a very
realmente
heavy one.
más
And
problemático
sometimes it creates more problems than the consumption itself.
Excelente, muchas gracias.
Thank you.
Nos informan desde el equipo
So
que
they
está
are
revisando
telling us, from the
participación
team that is
de la
actually
audiencia, nos
checking the
indican que hay
participation of
muchos
people. They are
adolescentes
telling me that there is a
aquí
lot of
como
adolescents
para
present.
dar un mensaje
And so
relacionado
just
a
to give
estos
a
mismos
message
riesgos
maybe about the
a los que
risks
están
also
expuestos los
that they are
adolescentes,
exposed to, that the
tenemos un
adolescents are
grupo de
exposed to. We
preguntas
have a group of questions about
que
that.
quisiera presentarles. Primero, ¿cuáles son las
So
consecuencias
first,
del
what
consumo
are
de
the
drogas? Parece una
consequences of
pregunta
the
muy
consumption of
extensa,
drugs?
pero
And it
quizás
seems like it's a
podríamos
very
verlo
broad
con algún
question, but
ejemplo
maybe we can talk
de las
about an
drogas
example, or,
de
give
las
an
que
example of
se
the
han hablado hoy.
drugs that you have been talking about today.
Otra pregunta es, ¿cuáles son las
Another
habilidades
question is, what are
personales
the
que se deben
personal
desarrollar para
skills
no
that
dejarse
should
influir
be
por el
developed so
consumo
that
de
you
drogas?
do not are pushed and
Asimismo,
pressed into
¿cuáles son los
using drugs?
principales
And then
desafíos
also, what are the
familiares
main
y
family
sociales
challenges
para
and
prevenir
social challenges
el
to
consumo de
prevent the
estas?
consumption of drugs?
Y
And then,
¿qué estrategias efectivas
what
existen para la
effective strategies
prevención del
exist
consumo de drogas en
for the
adolescentes?
prevention of drugs
Y
among
también desean saber si
adolescents?
es que los
And then they
efectos
also want to
varían
know if
entre
these
los tipos de
changes
drogas, ¿no?
between the different types
Em,
of drugs.
¿Hay alguna estrategia
Maybe
específica
there's
para
a
drogas
specific
naturales
strategy
y
for
otras
natural
para
drugs
drogas
and a
sintéticas
different
o
one
las
for
nuevas
synthetic
sustancias
drugs,
psicoactivas
or,
que nos
others.
podrían mencionar al
What can you
respecto?
say about this?
Bueno, en relación con la temática específicamente de reducción de la demanda,
About reducing the demand, really,
una de las, digamos,
one of
de
the
las problemáticas que
main
precisamente estamos
problems
abordando acá es
that
tratar de
we
entender a
deal with here
abordar
is to
de
pretend to deal with this problem directly. You know, I've always said that there's professionals working directly in reducing the demand. And we think that
la temática es específica en reducción de la demanda, ¿cierto? Al considerar que es específica en reducción de la demanda,
when we consider that this is specific,
la respuesta debe direccionarse hacia los expertos en reducción de la demanda. Desde la oferta, lo que yo podría decir es que cada día están
what I can say is that every day
más drogas, diferentes
there's
drogas,
more drugs, new drugs and new combinations that imply more challenges both for the supply and the demand, and that implies more specialization, and it imply also more threats for the consumers in terms of health, in terms of characteristics of the substance, in terms of specificity or the power of the substance to create addiction, to generate addiction. So, you know, as Claudio very well put it, you know, we have the case of the mitazines, and it's always a kind of substance, but it's not in the same group as fentanyl. And so I would say that, you know, all of these questions related to the demand, definitely the right person to answer about mechanism, these would be the subject matter experts.
Bueno, realmente son tres preguntas
So these are three questions that are quite complex and definitely broad. And of course, I am not an expert to answer, you know, all of them. I work more in reducing the damages. I don't work a lot on prevention, let's say, you know, with people, with adolescents that are not consuming, but we actually work with people who are already consuming. They are already consuming, and so we work on reducing the damages. The risks that they are exposed to are different. It's already more specific risks that has to do with the substances that they consume, where, how, and who with they consume. So it's quite a complex phenomenon. And the risks do not only, you know, depend on the substances, they also depend on who consumes and how and where. And, you know, there's a whole array of variables and factors. I would like to say, though, that in terms of prevention and strategies that can be effective, definitely there's many initiatives from the United Nations, and in our case in Europe, there's also different initiatives that have been, you know, conducted in terms of compilation of best practices and standards for prevention, trying to identify what are the strategies, the best strategies that, you know, have the most evidence in terms of effectiveness. And, you know, there's also the issue of, you know, not everything will be useful in every region. We need to take into account the cultural factors and all of that, you know, that's also important. So I would just say, you know, those who are interested in knowing more about this and looking for these kind of resources, definitely they are available. I'm pretty sure that they will be used to start looking at this topic. Thank you very much to both. Another question is, you know, legalization of cannabis, has that had an impact on the incidence and the consumption rate of psychoactive substances in the territories where this is legal? And then, you know, going back to the previous question, you know, in the case of having the right approach in terms of the supply, you know, I can talk about the impact that the legalization has in terms of the reduction of the demand and the approach. So what we can say is that many countries in the region, you know, there have been two types of legalizations. We've had the legalization of cannabis for the production of, medical cannabis.
De sustancias con carácter terapéutico y en algunos
And then
países
in
se ha
some
llevado a
countries,
cabo
we
una
have had
legalización con
a
distintos mecanismos.
legalization of cannabis for
Tenemos
recreational purposes. So, of course, I have information, very general information, that there has been an impact. It has had an impact in terms of the demand, but I don't really have information in terms of the type of consumption or, production, or I don't really have that information. But what I can say is that based on the types of
en tres tipos de cannabis
cannabis,
específicamente.
they've been able to control
Cannabis
three types of cannabis.
destinado a la producción industrial que
One that is
tiene menos
related
de
to
1%
industrial
de
production that has,
THC,
less than 1% of
el
THC,
cannabis
which is
denominado normalmente como cáñamo, que algunos países lo
the
tienen
hemp.
ya reglamentado,
And I
un
think some
cannabis
some
con
of them,
menos
some
del
countries
1%
have
de
them regulated.
THC, pero con
Then
un
there's countries
porcentaje
that
mayor de
have cannabis
CBD
with less
destinado
than
a
1%
la
of THC,
industria
even more than
farmacéutica,
CBD,
que
which
ya
is
muchos países lo
aimed at
tienen
the
aprobado y que
pharmaceutical
están
industry.
en
Some countries
funcionamiento,
have
y
approved
el
this,
cannabis
and then
con
also
mayor
cannabis
concentración de
with a
THC,
greater
que en
concentration
muchos
of
países
THC, that
todavía
in
se
many
encuentra
countries it's still
controlado ese
controlled.
cannabis como droga y en otros
This cannabis
países
is
ya es
still
ilegal.
controlled and is considered as drug, and in some others it has been legalized.
Bueno, yo pienso, y claro, y aquí quizá voy más
Well,
a una opinión
here maybe I'm going to give a more of a personal opinion
sobre esta
about
cuestión.
this issue.
Realmente sí que tenemos información
Definitely we do have information
de que podría haber unos
that
ciertos
there could
aumentos
be
en
certain
la
increase
demanda.
in the
Luego
demand.
también tenemos
And then we also
para
have,
atender a este paciente, ¿no?
when
Los de
we
Estados
look at it
Unidos,
specifically to the US, for instance,
pues incluso desde el propio NIDA se ha reconocido que no se habían detectado
they,
aumentos en la
recognize
demanda
that
por
they have
parte
not
de
seen
los
any
adolescentes,
increase in the
que eran
demand
ellos los
by adolescents, which
los
which was one of the
que,
fears, really.
que más había, ¿no? Y por lo tanto,
And
tenemos que pensar que ahora mismo se están
therefore, we
produciendo
need to think
experimentos
that there are
absolutamente
experiments
naturales,
that are
¿no?
absolutely natural,
Y sobre los que tenemos que ir reflexionando.
and
Yo creo que también con
especially
toda
we
la
need to
información en
compile
Europa,
all of this
también
information.
varios los
In
países
Europe, I think there's still
han puesto
there are
marcos
several
regulatorios
countries
en relación al
that
cannabis y
have
por lo tanto
regulatory
todavía
frameworks in terms
supongo
of
que es
cannabis.
pronto para
And I think
valorar
that
la
it is
situación,
still too
especialmente
soon
cuando
to know
tenemos
about the
diversidad de marcos
situation,
regulatorios.
especially when we have
Tenemos
different
marcos
regulatory
regulatorios
frameworks.
tipo
We have
Estados Unidos,
regulatory
que de alguna
frameworks like the
manera
United
tienen
States,
tradición
where,
industrial
half of it
claramente
is
o más
absolutely
enfocada
commercial and more focused
business,
on
¿no?
business,
Mientras que tenemos otros marcos
while we also
regulatorios
have other
de
regulatory
fuerte
frameworks
control estatal
where there is a big state control
de todo el sistema
of the whole
y por lo tanto
system.
eso también podría tener
And
impactos
therefore, it could
en
have
distintos
different
niveles de
impacts
demanda,
on the demand.
etcétera, incluso a nivel
And
de pobreza y desnutrición, que
even
son
in
también
terms of what is the disruption that this can
sobre
create
el tráfico ilícito, ¿no?
on
Yo creo que todavía es
illegal
pronto
trafficking. So
para poder
definitely,
concluir
it is
en
too soon to know about or to have a
Gracias a
conclusion.
ambos.
Thank you
Tenemos
both.
dos preguntas
So we have
adicionales.
two additional
y,
questions.
Esperamos que sí
We
se
really
adecúen
hope that
a sus competencias,
I hope
porque
that these questions
una
are
es, por
related to
ejemplo,
your
qué
topics of
competencias
expertise,
concretas
because
consideran
one,
que
for
deben
instance, is what are
tener
the
los
concrete
recursos humanos de
skills
salud
and abilities
ante la
should the
diversificación de
healthcare
drogas
professionals
en
have
Andina, ¿no? Donde
now facing this
convergen las
diversification of
drogas de
drugs in the
origen
Andean
natural,
region,
que ya
where
tienen
we
un
see the
historial
convergence
enorme,
of natural
y las
drugs
sintéticas,
and
¿no?
synthetic drugs?
Y otra pregunta
And then the other
es,
question
¿qué
is,
resultados
what
muestran
are
la
what are the
implementación de
results
salas de
of the
consumo
implementation of the
supervisadas
consumption rooms
en
or
Europa o
supervised
en
consumption
otras
rooms in
regiones?
Europe
¿Es
or
una
in
buena
any other region?
estrategia?
Is this a good
Por favor,
strategy?
siéntanse libres de
So
responder
please
la
feel
pregunta
free
con la
to
que se
answer
sientan más cómodos.
the question that you feel more comfortable with.
En el caso de la primera pregunta, sí es muy
So for the
interesante
first
esto,
question is very
porque
interesting,
en
really,
nuestra región lo que
because
hemos
in our
visto,
region, what we have seen,
especialmente, y lo decía en mi charla,
especially, and I said this in my
en relación con el
presentation
trabajo
about
coordinado
the coordinated work with
con el gremio de la salud, si se quiere,
the healthcare sector,
no hay, digamos, mucha
is
coordinación
there
desde los
really
diferentes
no
componentes que abordan la
uh,
problemática de droga ilícita
a lot of
con los
components dealing with
componentes de
this
salud.
and looking at the
Sí.
component of healthcare.
Normalmente las reuniones o los foros o los eventos de drogas difícilmente convocan a los profesionales de la salud para abordar la problemática. ¿Sí? Y para ellos pues es complicado porque si
And
nosotros
so for
vemos ahorita
them,
hay
this is complicated.
1.240 nuevas sustancias psicoactivas que se han reportado, no necesariamente que estén en el mercado, que se han reportado, más las drogas de síntesis, más las variaciones que puedan tener las drogas naturales. Y si nosotros nos vamos a ese abordaje integral que se puede hacer desde digamos, las temáticas que nosotros normalmente trabajamos y llevamos esta problemática hacia los digamos, centros de urgencia, centros de salud, el cuerpo médico especializado, es muy poco, digamos, el trabajo coordinado que existe. Es como si ellos estuvieran aparte, pero no por culpa de ellos, porque desde el abordaje de la problemática de drogas normalmente no se convoca al cuerpo médico. Un caso típico fue por
A
ejemplo,
typical case, for
el caso
instance,
en
was
Argentina
the
cuando hubo el
typical the
accidente
case in
con el
Argentina when there was
fentanilo.
the
¿Cuánto
accident with
tiempo se
carfentanil.
necesitó para
How
que
long did it take
los centros de
for
salud
the healthcare
donde llegaron
centers
las
where,
emergencias
all of the
lograran trabajar
emergencies
de manera
arrived to be
coordinada
able
con
to
los
work in a
jueces
coordinated
y
manner
poder determinar
with
qué
the
era lo que
different
estaba pasando?
forensic professionals
¿Sí?
and determine what was
Y
happening?
eso generó una
It took a
demanda de
while, and that
necesitar
created
trabajar de
the
manera
alert
más
and,
coordinada
showed the need of working in a more
con los
coordinated
servicios
manner
de
with the
urgencia, con los
different
centros médicos
emergency teams and the
especializados.
specialized healthcare centers. It's hard,
No tenemos
definitely, it's hard because
conocimiento
we
de,
don't
por
really
ejemplo,
know
que aquí en la
exactly,
región,
that
incluso
maybe
a
in this
nivel de
region,
preparación médica, hay
even in
menos
terms of
expertos
prepare, when we
de
talk
los
about the
cuerpos médicos, de las
experts, of medical
facultades
experts,
de medicina estén
and the different
abordando de
medical
manera
schools, we don't even know if they
sistemática
are
la problemática de las
systematically and
drogas
technically
ilícitas, así
dealing
como
with
hay un
this
seguimiento
and
a la aparición de
doing
nuevas
maybe a
nuevas
follow-up
drogas,
to the
como
appearance of
para
these new
generar
drugs
herramientas que
as
les
to
permitan a
generate
ellos las
tools
nuevas
that will allow
respuestas
them to
eficientes.
give a
Yo creo
more
que en eso
efficient
tenemos que
result.
hacer un trabajo
So I
mucho
think we
más
need to have
coordinado
work in
con
a
los
more
cuerpos de
coordinated
salud.
manner
Y lo
with the
mismo en el
healthcare
caso de
professionals. And I
Latinoamérica,
am talking
desconozco
about
el
the Latin
caso
American
en
case,
Europa, pero
I
en
don't know how it
Latinoamérica
is in
también
Europe, but
ocurren
in Latin
dos
America,
áreas totalmente
definitely they look
independientes
like two
con los
completely
mismos
different
departamentos y
areas and
profesiones que tienen.
silos. And I think we should work together.
Sí, un poco por también seguir, ¿no? Esta línea del
Yes,
doctor
and
Bernal,
continue
yo
also to
totalmente de
continue
acuerdo. Yo creo que
with
cuando
this idea, and I agree with Dr. Bernal.
tradicionalmente
I
hemos
think
ido diciendo
traditionally
que
we
las
have been
políticas de
saying
drogas
that
en su tipo
the
también
drug policies
reducir
are
la
always
oferta,
divided
me
in terms
refiero,
of
¿no? La
reducing the
economía
supply,
internacional,
reducing
como nos
the
lo hemos tomado muy a pecho y al final hemos creado tres
the
cajones,
demand, the
¿no?
supply, and I
Entonces,
think we have created three silos, three
yo
completely
tanto
different
por mi
silos.
experiencia
And based on
como
my
trabajador en mi
experience
organización
and
y
my
referente en el
organization and the
patronal, lo que
networks that
vemos
I
es que
participate in,
especialmente en nuestro
I
ámbito,
see
las
and
fronteras
mainly
entre
this,
reducción de la oferta y reducción de la
limits
demanda
between reducing the supply and
se
reducing
empiezan
the
a quedar
demand and
definidas,
international cooperation, they
¿no?
are being
Y
disseminated. And
lo
so,
mismo
and the same
necesitas
thing,
saber qué está
we need to
ocurriendo a
know
nivel de
what is
demanda, cómo la gente
happening
está
at the level of the
consumiendo,
demand, how
por qué
people are
consumen,
consuming or what are they
qué
consuming,
problemas está
and
teniendo
what are the
la
problems that they are
industria y
having,
luego quién se está
etc.
encargando de
And
la
who
producción,
is
qué cambios está
actually in
habiendo en la
charge of production,
producción,
what are
qué
the
está
changes
habiendo
in production,
en el
if there is
suministro de
any change in the
precursores,
supply of
de
precursors,
preprecursores,
of
porque todo está
pre-precursors, because
relacionado,
everything is related in the
¿no?
real
En esta
world. Everything is
configuración
intertwined.
sociopolítica,
Maybe in
¿no?
this
De este
political
tipo, de
construct
reducción
that
de
we have
oferta y
created, these
demanda,
three
puede estar
silos,
muy bien sobre el papel, pero
maybe it
luego la
looks well on
realidad
paper, but then in the
es otra
reality, it's a
cosa.
completely different
Yo creo que
thing,
en Europa
completely
hemos
different. I
avanzado
think
en
that
ese
in Europe, we
sentido
have made
y
much
sobre
progress on
todo
this.
cuando
And for
hasta
instance,
ahora el
when,
servicio
they create
del sistema de alerta
the
temprana, el
system,
Early
the early warning
Warning
system,
System,
uh,
opera el Observatorio
that
Europeo,
operates,
¿no? Que quizá estaría más del lado de la demanda, pero también Europol,
we
¿no?
also
Y al
have
final es un
Europol,
sistema combinado
and
de
in
dos
the end,
partes
it's a
que sean
combined system.
representantes de
where we have representatives of, in reducing the supply and reducing the control, but having a one single system where they share information. So I think that, we've given some steps, but still, when we, land all of these and we go to the realities, it is evident that we need to still increase and broaden our perspective and reduce the silos and have all of them work together, because definitely in the end, and Dr. Bernal said, everything will be compartmentalized and siloed, and all of the bridges are changed and broken, and they should never be broken, because the reality is not like that. Reality is everything is together. And about the consumption rooms, and I'm going to answer this very quick. For many, many years, we know that the effectiveness of the consumption rooms, supervised consumption rooms, especially for the creation of, these spaces for vulnerable people that don't have access to other resources. I think these are, like, consumption rooms are open to people who are in extreme vulnerability, and we know that they are very useful for them, and we also know that they are useful to save lives. Uh, we see that there was a reduction of the number of overdoses. There may be early responses if there is an overdoses, and so of course we can also work with them without the need of them to go into a network that is not useful. I mean, if they don't implement it more, I think it's just because of a political will issue, there's a lack of it.
Muchas gracias por sus
Thank you very much for your
respuestas. Han
answers.
sido muy,
They
muy
have been
enriquecedoras
very,
y
very
enriquecedoras.
clarifying and very, very
Asimismo,
valuable.
agradecemos a quienes
So we would like
plantearon
to
las
also
preguntas.
thank those who
Definitivamente no hemos
asked the
alcanzado a
questions.
responder
Definitely,
todas,
we have not been able to
pero
answer
nos
them
sirven
all,
para futuros
but they
webinars
help
y
us for
definitivamente
future
vamos a seguir
webinars, and
compartiendo con este
definitely
tema
we're
tan
going to continue
importante.
with such an important topic.
Reiteramos el
Again,
agradecimiento
we would like to thank
por las excelentes
uh,
ponencias del día de hoy
the
a
two
los
keynote speakers
especialistas
today,
Héctor Bernal
experts
y
Héctor
Claudio
Bernal and
Vidal.
Claudio Vidal, for your excellent
Asimismo,
presentations today.
agradecemos a
Also, we would
todas y
like
todos
to
los
thank
participantes,
all of
al
the
equipo del Horacio Conu y a todas las
attendees, the
personas que
Horas
participaron en
Conu
este
team, and
evento.
everybody who participated in this
Ha sido
activity,
posible
which
gracias
has
al
been
compromiso
possible
con la
thanks to the
integración
commitment
andina
to Andean and Latin
latinoamericana y
American
también
integration,
iberamericana.
and
Me quedo.
also Ibero-American integration,
Cedo
because
la
we have a
palabra
Spanish
a la
speaker now.
doctora María del Carmen
So
Calle,
now I'll give the
secretaria
floor to Dr.
ejecutiva,
Maria del Carmen
para el
Calle,
cierre de este
Executive
webinar en
Secretary,
nombre
to
del
close this
organismo
webinar on
Andeano de Salud
behalf
y
of the
convenio
Andean Health
Hipolito.
Organization,
Adelante, querida doctora
Hipólito
Calle.
Unanue Agreement.
Muchísimas
Dr.
gracias.
Calle, you have the floor. Thank you very much.
Yo quisiera,
I just wanted
yo
to
quisiera de todas maneras darle a cada uno un
give
minutito de reflexión final.
each speaker one final minute, 1 minute to each one of you, because I have a lot of questions. But of course, you won't be able to answer them all, because we need to finish this, wrap up this webinar. But there's a lot of there's demand, there's supply because there is demand, and that is the reality. If there was no demand, there's no supply. That's what I think. And then those who provide the supply are very, smart, because they, of course, they know about this whole, context and change. And sometimes you say, well, but why? Why some get hooked and some others don't? Because that is the truth. It's part of being, an adolescent and looking for sensations and seeking for feelings and emotions and sensations. And there's definitely someone who's going to try. But what happens, why some people get hooked and some others don't. And I think that's important to know. And then comes prevention, right? Prevention and having a good family support, not having the drugs within reach, also mental health support for those who are more vulnerable. There's so many things happening. However, I think this is something that is important, and I like what Hector said. Nobody calls the health professionals, and it is true, but this is also, doing drugs is a crime. And I think that should be I will give you the minute first, but first I want to, have catharsis. This is what's important here. Drugs, it's a crime, and there's drug trafficking, and that exists. And then, in the following part, it never it's really recognized alcohol as a drug, for instance. And then alcohol is the gateway drug for all the other drugs, and we all know that, So, and then what you said, there's like 1,240 different ways of different new drugs, and that is true. And so definitely they're going faster than we do, for sure. So my question is that, just you have 1 minute each to close off. I just want you to tell me, is it working? Is this working in the countries that are so restrictive? I was just in Singapore. I was just in the South East Asia, and they really have no issues there. They just, put them in jail or they kill them. There's not a lot of option there. And so I say, what about that? Does that restriction work? It doesn't work? Is there less consumption of drugs in those countries where they are more, punitive? Because there's countries that are completely punitive and restrictive, completely. So if they catch you, then that's it for you. So I don't know, is that a good way? Is that not a good way? And then on the other hand, the issue of the labs, of the, labs that can do tests to diagnose, because there's drugs that are still not being, diagnosed in the labs because there's no methodology yet. And then the human resources. I am a physician, I am a doctor, so I studied many, many years ago, but if I think about this in terms of mental health, drugs, I didn't see much of that. And that also has to do with the study plan and the curriculum. You look at psychology and nursing and everything, and drugs is really not part of that. It's not part of the study plan.
Y también el hecho de que los consumidores son enfermos, tienen un trastorno, ¿no? No es que sean delincuentes, horribles, qué mala gente son, no, están enfermos. Es un trastorno que está reconocido, ¿no? Entonces, esto es súper complicado.
So this is very complicated. We know that this is very complicated. I would just like to give you a minute before I close this, but I wanted to share this with you. I'm also inviting you to, work together with us. Maybe we can have a workshop or a course or something else, not just a webinar, because here, half of the people are asking a lot more things. So we would like to see, okay, how about getting together? Maybe we can get together with Orasconu and Energy Control, or, maybe do something that can be useful for more people. Especially our healthcare professionals, because I feel that they are not necessarily really prepared for what's coming, because this is not going to stop. Of course, we are going to have, okay, I'm sorry, Ruby, that I used up more time, but so we have 1 minute each. Héctor, please.
No, muy interesantes todos tus análisis. Lo que simplemente hay que tener en cuenta que el problema de
So we just need to realize that the drug problem is, multifactorial. It has a lot of approaches, and it has approaches that, have a lot to do with technical, political,
el problema de las drogas influye en la política en muchos países
and
en el
that
mundo.
has an influence on a lot of countries in the world. And so, it is the gateway to many approaches, of course, when it comes to the political philosophy.
Desde lo técnico tiene muchas dificultades y se puede abordar de muchas formas. Hablamos ahora, podemos hablar desde la oferta, podemos hablar desde la demanda, desde la cooperación internacional, desde lo administrativo, porque decimos que para producir las drogas se necesitan sustancias químicas, pero las sustancias químicas son el motor de desarrollo de los países industrializados. Entonces también si yo voy a controlar las sustancias, tengo que abordar lo administrativo, tengo que abordar el comercio exterior, el import-export. Bueno, son infinidad las variables que hay que pueden permitir un abordaje. Entonces, para un problema multivariado, abordajes multivariados. Algunos se encuentran, algunos son sinérgicos, algunos chocan entre sí. Respetamos lo que los países decidan desde Naciones Unidas para el abordaje de su problemática y consideramos que algo muy importante para poder entender mejor esta problemática, pues es trabajar de manera coordinada entre la sociedad civil, las instituciones, desde lo gubernamental, desde lo particular, ¿cierto? Porque es un problema muy complejo. Lo importante es trabajar en él para poder entenderlo. Sí, es evidente que en algunas regiones el cuerpo médico está aparte o pareciera que estuviera ausente y a él solo le llega el problema para solucionarlo en el momento de una crisis o una urgencia. Esas son abordajes que hay que, digamos, que tratar de minimizar esas brechas que existen ahí. Eso hay que hacerlo y seguir trabajando en la problemática. Obviamente que no es un problema que se va a acabar ahora. Es un problema que cada vez se va a diversificar más. No es que esté desapareciendo la droga natural y que esté siendo reemplazada por la droga sintética. No, están complementándose y eso lo hemos visto. Ayer precisamente en el Día Mundial de las Drogas se lanzó el Informe Mundial de Drogas y está indicando que crece la producción y el consumo de metanfetamina, crece la producción y el consumo de cocaína, crece la producción y el consumo de opiáceos, de opioides. Entonces la problemática es muy dinámica, por lo tanto los abordajes deben responder de la misma forma a la problemática.
Gracias.
Bueno, yo también para
So I
terminar,
just finish and wrap up. I just,
daría para estar aquí hasta mañana casi.
I think this topic, we could be talking about this until tomorrow. So it's definitely very complex. But evidently, we are talking, when we talk about drugs and everything that this implies, it's something that is, there's nothing that makes us think that this is going to stop. We don't really have any evidence that that is going to be possible. So we need to find a way so that the impact on people and the impact on societies and communities is the least possible. And that is obvious. And we need to keep on working towards that. We also need to work for the impact of the policies are lower as well. We know that there's certain policies that have a very negative impact on people. And we know, for instance, that the lack of proportionality, they also have an impact on people, on people and on communities. And so thinking about consumption of drugs as a crime also has a negative impact, and even more sometimes than the consumption itself. And therefore, I think we need to go towards decriminalization of the consumption. Yeah, what I mean is drug trafficking. I didn't say consumption.
Sí, sí, no, pero hay países en los que el
And
consumo
there's
es
some
delito.
countries where, consumption is crime. It's not legal. And this doesn't have an impact on negative impact on people.
Puesto que estamos hablando de organizaciones criminales que no solamente muchas veces se dedican al tráfico de drogas, sino que también tienen diversificadas sus actividades criminales, ¿no? Y por lo tanto el sistema penal tiene que
the
actuar.
criminal system, of course, also has to be revised and updated. And then especially, considering not everyone that use drugs use it because they have a problem or because they have an addiction, etc. But, just there's a group of people that definitely are exposed to these risks. And we need to clearly identify and we need to act, in the best way possible. Because sometimes it's not, I think we need to change the mindset and also, and we need to start thinking about the healthcare component also when we talk about drugs. Thank you. Okay, well, thank you very much again. It's been really a very, very valuable and productive webinar.
Porque esa es la idea del Organismo Andino de Salud, acercar toda la información y estar en un constante interaprendizaje para brindar más herramientas a nuestros, digamos, a nuestros participantes, ¿no? Que
we are always thinking of providing more tools to our participants who loyally are joining us every week. We are in webinar 230 now. So we really want, whenever we have webinars that are so important for us and interesting, we really want to think about, more information and ways to get to more people. Thank you very much, Hector. Thank you, Claudio. Thank you, Ruby. And thank you to the whole Horace Konu team that made this webinar possible. And we would like to invite you all to the next webinar on July 4th at 11 a.m. Peru time. We are going to talk about generations, this different generations working together. And we're going to talk about intergenerational approach, which is so important and trying to promote. Thank you very much and see you soon. Thank you.